Hi, this is Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update for the town of Falmouth. Today is August 6, 2021. To email the Health Department, you would use health@falmouthma.gov. Our website is falmouthma.gov as well. Our phone number is 508-495-7485 if you need to get a hold of us. So I'm going to start out with cases. I stop these Thursday afternoons every week. So we have 1,630 cases since the beginning of the outbreak. 21 during the week from Thursday to Thursday. So, that's higher than what we've seen, and we've had a steady increase in cases. 10 probable cases this week, which is the rapid test. About 98% or so of cases are out of isolation. We've been hovering right around 11.2% of all cases. Our positivity stayed the same, even though a slight increase in cases, a little bit of increase in cases because we've had more tests. So that's based on the number of tests that are given us. So that 14-day positivity for the provided by the state is 2.47 for this week. In terms of our case chart, this is the chart that we do every week. It shows you the number of cases per week in chart form. Shows that you can see that we've had an increase for the last 4 consecutive weeks. A little bit of that's been due to one long-term care center, but most of this is community spread. We are seeing, definitely an increase in cases. It's the first time we went over 20 cases since the beginning of May, end of April. And so, that's where we are with it. And I'll talk a little bit more about vaccines and everything in a minute. So this is our, the flatter this line, it shows that we're doing better, that we used that term back in 2020, flattening the curve. You can see that we're starting to show an increase. Not quite like you saw in January where there was just this rapid ramp in a matter of a few weeks. It's definitely lesser, but nonetheless, there has been an increase in cases. Same holds true for the county. This is the county's chart, similar to to what we've been tracking here at Falmouth. You can see that we've sort of mimicked that increase in cases. Obviously, with the Provincetown situation, that's higher than maybe what the rest of the county is seeing, but that's all, it's in there with the county numbers. You can see that it's starting to tail back a little bit because Provincetown's seeing a decrease in cases. They sort of hit the crest with that cluster that they had. Good news is hospitalizations are still pretty stable. 1 and 1 at Falmouth Hospital as of the 5th, which would be yesterday. Cape Cod Hospital was 3 and 0 in the ICU. If you go back as far as 6/16, we were 3 total. Now we're at 4 total, and 1 in the ICU with none in the ICU. So it hasn't really jumped as a result. And with the Provincetown, you see that was 8 hospitalizations, over 1,000 cases, with over 70% vaccinated, roughly 75% vaccinated. So that tells you the vaccines are in all indication that the vaccines are doing their job for hospitalizations and serious, sort of the serious cases of the disease. So that's where we are for our chart. I'll go back to this when I talk about some other things in a bit. Statewide, we're over 1,000 cases per day. We were under 100 for a while in June. So you see that our positivity for the state is at 2.61. That had been down to 0.7. So the state seeing what we're seeing, an increase in cases. Hospitalizations have not gone up at the same rate. When I show you the trend chart, there is a little bit increase in hospitalizations, not in deaths. So the lower right hand is deaths in purple, hospitalizations in orange. You see a bit of an increase in orange, not in deaths, but you definitely see it in the top two, the blue and the green, which show you cases. So seriousness below and cases above, you see that there's been definitely a bigger rise in cases than there have been in hospitalizations. Again, thanks to the high rate of vaccination that we have in the state, and especially here in Falmouth. Barnstable County is 70% of individuals are fully vaccinated in Barnstable County. In Falmouth, our weekly charts, we had 172 new first doses issued. Since Delta, we've seen that number go up. It was well under 100 for a while. We're at 77% first doses, 70% totally vaccinated. If you took just eligible residents, we're 77% of all residents, eligible residents are fully vaccinated. You see where we've made the gains. We've made the gains in the group that has been seeing the most cases throughout is the 16 to sort of 35 range is where we're seeing most of the cases, and you're seeing that's where we're getting an increase. So there's been some change in mind about getting the vaccine or hesitancy. There has been some that have taken the leap and gotten at least the first dose. There's also been an increase slightly on second doses. We went up 87 second doses. So you do see slight increases. They're a little bit higher than the increases we were seeing maybe a month ago, mainly because you're hearing about the Delta and the push to be vaccinated. And of course, we'd like to see everybody get vaccinated that's eligible. And so you see a little bit of an increase in the numbers here in Falmouth. Availability, again, Mass Vax Finder. You can find the pharmacies. You can go directly to the pharmacies. There's plenty of doses available. Call the health department if you're truly homebound. We can work with the VNA to get you taken care of. We are having a clinic on the 9th of August, and then the second dose will be the 31st through the schools. That'll be, I believe, at the high school. So contact the school department if you're, they've already messaged this out to the schools, the school parents. So, that will be a school-based clinic starting up, so we can have at least another round done prior to schools opening. Yeah, vaccine efficacy. There's a calculation you can make for vaccine efficacy. So if you take all the cases, so I had to assume a vaccination rate when you calculate this, so I kind of averaged what we were doing between March and today, and we come up with 91.5%. That was, assuming that's taken into account March vaccinations and breakthroughs and so forth. Since July 1st, which I choose as the date of which Delta was here and was predominant, you can see it in the cases. We had no cases the end of June into early July, and then boom, we've had cases. So I used July 1st as the cutoff. The total efficacy is 64%. If you factor out the long-term care, because I think you all realize that the groups that are in long-term care were vaccinated earlier. So it's been almost 7 months for some, 6 to 7 months, and those in long-term care, a lot of times, their immune system isn't quite what it used to be, and we tend to have a higher rate of vaccine breakthrough. I don't think that's a surprise. If you factor out the non-long-term care, our vaccine efficacy is around 72%. I think reading in the UK, it's been around 60% is what they're figuring. 90 plus for serious. This is just cases. This is not the severity. This is not telling you the severity. It's just those that are banging positive after being vaccinated. The vaccines, from the hospitalizations show that it's effective. Maybe less so for actually getting it. Going back to county, this is the incidence rate, so you can see what Provincetown is what's driving the high area of infection for the entire county. The rest of the municipal, Truro as well, being close to, it's got sort of an effect from Provincetown. But most towns, as you get further towards us, have been in sort of that 10 plus or minus of the incident rate. So it's a little skewed when you see, all of Cape Cod as a red. It's really sort of more been in the outer Cape. Much like in the spring, you'd saw it in the sort of the mid-Cape area when we had our surge in spring of the B117 variant. You can see that most towns are trending on the higher side for for increase in case count. For this particular time frame, there was 31 in Falmouth. That was from the 18th to the 31st. You can see other towns, some towns, Barnstable was 72, Provincetown was 158, Truro was 29. A lot of people are residents, they have a smaller residency, that's a big number for them, so their incidence rate was as high as 437 for that time frame. That's a real high number. That's what happens when they have that big cluster, and so that's where we are with that. The Delta variant, I probably should increase this to over 90. It's well over 80%. I should have updated the slide. Is much more transmissible than the original version. Somewhere I've heard 2.5 times. It depends on who you look to. It does reduce efficacy because there's a higher viral load. The higher viral load that you have, the quicker that you become symptomatic, and your memory from the vaccine kicks in. But there's that fine line when you're symptomatic and not symptomatic sometimes, and these tend to trigger more milder infections, but do trigger they go past the asymptomatic into the symptomatic realm because of the viral load that this is able to produce so much more virus as it replicates inside your body, and what you take in as well from someone else. So current guidance, we've been getting quite a few calls about mask mandates and, the road race and things of that nature. So let's just start where we are. So there are no state guidance. That was eliminated in May. The town of Falmouth, the Board of Health and Board of Selectmen issued a mask advisory for all people that they should wear masks in public indoor places. It wasn't mandated. On July 30th, the state updated because of Delta a mask advisory, wear mask indoor if you're unvaccinated, or if you're vaccinated with a weakened immune system at risk for severe disease or underlying medical conditions, and masks still required in some settings for all people, like such as public transportation. There hasn't been any discussion at the state levels with municipalities on reimposing any guidance or restrictions or even mask mandates at this point, cancellations or occupancy limits. So none of that's being discussed at the state level. We've tried to get our guidance from the state level, so we're doing it more on a consistent basis. From the CDC, vaccinated people should wear masks in indoor public spaces. If there's substantial higher risk, you should also wear masks. So looking at that, you see if you should be wearing masks in an area of high or substantial transmission, is Falmouth one of those? And the answer to that would be no. This is from the CDC. It says that a low infection would be an incidence rate of 0 to 10. We're at 7.1. It would be low. High would be over 100. Or substantial would be anything over 50 to up to 99. Positivity greater than 5%. Greater than 10 would put you into the high category. So we're in the low category for that. Now, looking at what happened in Provincetown the last couple of weeks, they would be in the high, and they have a mask mandate. They fall in the high category of what happened to them. So that's the sort of the guidance that we have for that. They also ask us to look at hospitalization rates. We don't have a stressed healthcare system at this point. We've done fairly well with that. And we do have a robust vaccination rate. We're really high. So those three factors, the guidance doesn't push us to mask mandates or closures or of any kind. Also, I did have calls about with the road race, and I think with the road race is like, much like in Boston, people can go to take a ball game and walk down Lansdowne Street. There's nothing from the state indicating that we should be, limiting or reducing that. Now, there is some guidance on there. If you're interested, you can go onto the road races guidance. As far as wearing masks in the bus and encouraging them on the streets before they race. But we're not at a point or anything or any metric or anything that from the CDC or the state that is indicating that we should be doing anything different from what we're doing. So that's where we are with that. I know that some people that have emailed me will not be happy with that, but that's sort of where the basis was, is that I'm not seeing anything, and the health department's not seeing anything that would indicate that we would do anything different from continuing with some guidance on it, but not in the terms of closures, not having things, doing things of that nature. Obviously, if things change, then we can flip to things like a mask mandate. We'll watch the data and go from there. The same is true in schools. We're not the state education isn't necessarily providing a ton of guidance at this point. And so we'll have to look at some of these types of metrics and make our decisions based on these things. So, that's why some people might say why we haven't gone backwards as far as, some of our closures and some of the different things like that is state's not giving us any indication that we should do it. The CDC's not giving us any indication of what we should be doing for that. And so by parsing out the information from the CDC, what I can gather from the state, or the lack of information, these are some of the things that we'll look at when decisions are made in the future. Again, to recap, so virtually all guidance and orders is gone. It's been gone since May 29th. Everybody over the age of 12 can get vaccinated. We encourage everyone to get vaccinated. Our vaccine rates are much higher than the country's, and on the high side for the state, and even slightly higher than a lot of our surrounding towns as well. State metrics are showing definite increase in cases, not to the same level in serious illness at the same rate. So it's not 10% of the people are going in the hospital. Maybe early in the pandemic, you'd see a higher hospitalization rate, 9% or whatever it was. You're not seeing that right now. Delta variant's definitely the one that's here. It's everywhere. It's taken over from the Alpha one, the B117, and the original COVID. Vaccine breakthrough definitely occurs. And I'll spend a little time with this. We definitely see vaccine breakthrough. That's where I gave you the efficacy. We definitely see cases that are people that were fully vaccinated. There's no ifs, ands, or buts about it. It's definitely more people that haven't been vaccinated. And so, the idea behind these vaccines were not to prevent, let's say a common cold type of symptoms, cough, sneezing, or flu-like symptoms. It was more to prevent you to get into the hospital and get real sick or die from it. So that's where the vaccine's very effective. It's just less effective because of the viral load on the Delta vaccine for it to stop you from getting to the threshold of symptomatic where you'd go down and get a test. I've heard as much as 40% are asymptomatic, even though, that were exposed, that may be banging on tests. So again, if it mutes it down to a point where it's a manageable disease, then, the vaccine's done its job. I also heard yesterday that they'll be talking about, I've heard some questions about boosters. I think the state's going to come down with more, CDC and state come down more with stuff in September about that. I'm sure at some point we'll need to do boosters, especially to those in long-term care, congregate care type of settings. More to come on that as it comes out. I'll put it on my presentation here. And as far as Falmouth, our cases are definitely trending upward. Is 20 a lot? 20 is more than I'd like to see, but we have no guidance, no masks, no social distancing, no closures. A lot of people here, and we're holding our own with the 20. Is that a lot? I can guarantee you, after seeing what we saw in the spring and winter, that I know there'd be more than 20 if vaccines hadn't existed, that's for sure. So it might be in the hundreds. You saw how we had that going way back earlier on. Let's come back up to here. You see numbers up around, I think our most we had in 1 week was 110 back in mid-January after the holiday season, and the B117 started in over here in the spring. These one-day cases without any vaccine, this number would be off the charts because we know that Delta is more easily transmitted, and without any mass social distancing or restrictions of any kind, occupancy limits and so forth. This dots in these last couple of weeks would have been off the chart. So we know that the vaccines work, but we are going to have some breakthrough because we are. And so that's what I have for the week. And again, if you want direct questions, you can email the health department. We'll answer them. Or call us at the health department, and otherwise we'll see you next week. Thanks.